the remote regions of Nepal lack the most basic facilities. Sanitation is poor, and many homes do not have latrines. Families cook on open fires in rooms where children play. Literacy rates remain low as schools function with few teachers and with limited resources. However, perhaps one of the most visible tragedies of all lies in Nepal's constant struggle to provide adequate healthcare for its rural living people. Rural medical clinics are often under-functioning, and remote village populations suffer frequent epidemics of preventable disease and even death. The consequences are devastating.
We're still about an hour and a half or 2 hours away from the village. And you can see some of our local children walking towards us. And namaste! Namaste! Having first visited Nepal in 2000, I was mesmerized by the country and the people that live there. 6 years later, I decided it was time to come back. Early that spring, I was traveling to the Langtang region of Nepal, and there's a single dirt road that junctions at a village called Sabri. Sabri is an interesting place. From this village, travel occurs only by footpath into the foothills of Langtang Himal. It was in Sabri that I was summoned to a local house. And that's where I found a little girl. SUNYI was 4 years old. She had fallen into an open cooking fire high up in the hills in her family's yak hut. Her mother had carried her 4 hours looking for help. When I found SUNYI, she was dehydrated and in terrible pain. When I looked at her charred body, I knew that we had to get her help immediately. That spring, there was a political strike, and transportation was difficult, if not impossible. Kathmandu was only 80 kilometers away, but if we had to walk, it would take 5 days, and we didn't know if we had that much time. My concern was that infection would start in and that SUNYI wouldn't make it. It's funny, now, looking back at this situation, it seemed like the whole universe was working against us. Nothing was going right. A man trekking in that region managed to get a tourist jeep to come from Kathmandu to assist us. And he arranged to get SUNYI, her mother, and myself to Kathmandu, where we immediately admitted her to Kanti Hospital's pediatric burn ward. After that experience with SUNYI, a sort of seed was planted, one that eventually grew into the Himalayan Outreach Foundation. And our goal was clear. We would work to promote community health in remote areas of Nepal.
Due to challenging geographical, economical, and technical circumstances, remote health facilities struggle to provide adequate primary health care and emergency medical services. As a result, minor issues quickly become serious and even deadly.
In Nepal, in VDC level, in Village Development Center, there are so many health posts, sub-health posts, primary health care center, and district hospital also there. And but these health facilities has not well equipped and not trained persons. Common medical problems are gastrointestinal problems like diarrhea, vomiting, gastritis, worms infestation, and skin problems like scabies, burns of the children from fires, and head injury accidents from fall down from the tree and mountains. We must provide basic training to the all health workers for their effective healthcare services.
The Himalayan Outreach Foundation proposed to establish a medical clinic in the Rozawa district of Nepal. The clinic would serve as a centre for strengthening village health resources. Working in coordination with government health offices, a higher standard of community health would be achieved through direct medical services, technical medical staff training, and emergency medical equipment. In November of 2006, an old school building was donated by the village of Tumang. This would be the future home of the Himalayan Medical Centre. Once completed, the clinic would provide medical services in partnership with a local sub-health post. It would serve over 1,000 local residents, in addition to many neighbouring village populations. Renovations began with the help of local villagers. Women and men volunteered to carry wood from the forests high above the village and sand and stone from the river valleys below. Through coordination and teamwork, a sense of community involvement and ownership developed around the project. By January 2007, renovations were complete. The Himalayan Medical Centre officially opened its door to patients. The centre was designed to provide primary health care and emergency obstetric care services, increase medical capacity with technical medical training and equipment, coordinate medical health camps and community health education, and develop strategies to fully integrate the clinic into the local health infrastructure. In addition to direct service activities, the clinic has a strong emphasis on community outreach and health education. The centre staff teach health education in the local school, conduct a variety of courses for youth and women's groups, and participate in medical health camps. The foundation identifies programs to develop community-integrated approaches to addressing healthcare needs. One of the most devastating health issues in Nepal is the death of a woman due to complications of pregnancy. With that in mind, the centre's primary focus is the Safe Motherhood programme. Safe motherhood is an uncertain experience in rural regions. UNICEF reports that Nepal's maternal mortality rate is approximately 740 deaths per 100,000 live births per year. This statistic is staggering in comparison to other underdeveloped countries. By the year 2015, the United Nations Millennium Development Goals is to reduce the maternal mortality rate in underdeveloped countries by 75%.
If we can go in remote areas, I think the data is not accurate because in remote areas, so many maternal deaths are happened due to complications during pregnancy and childbirth. Such women are dying in the road, and such women dying in their own home. In my opinion, the maternal mortality rate could be much higher.
The Safe Motherhood programme operates under the mantra of maternal complications are not preventable, but maternal death is. The centre is the first emergency obstetric care unit available at the local level in the Rozawa district. The special medical unit is designed to curb the rate of maternal death. The Safe Motherhood programme cuts through economic, technical and geographical barriers through 4 initiatives: increasing awareness, increasing access, equipping facilities and providing medical staff training, and providing professional, sensitive care. The most fundamental aspects of safe motherhood lies in education. By increasing awareness, entire communities learn to recognize danger signs of maternal complications. Medical staff work with communities to increase their understanding of why women die during pregnancy. Maternal death is prevented through antenatal and postnatal counselling and by seeking timely treatment in the event of maternal complications. The centre is a life-saving healthcare facility. Medical staff organise community volunteer groups to conduct emergency transport of women using stretchers in the event of referrals to a district hospital. Stretchers can be the difference between life and death.
We opened the Himalayan Medical Center in the month of January 2007. We have been open for a month when a young man came to me and said me that his cousin was in the stage of labor and there was something going extremely wrong with her. So I just visited the family home, and then when I reached there and when I saw her, I knew that she was having eclampsia. That means having convulsion and the pressure rising during the time of delivery. She had to have a first aid service or first emergency obstetrics care. So I just asked her family to carry her to the clinic. And as soon as we reached the clinic, our goal was to stabilize her. And as soon as I established her in our clinic, we arranged a group of villagers to carry her to the near road where we can get the transportation service to escort her to the district hospital. Walking for more than 5 hours, there was a Red Cross vehicle waiting for us, and we carry her to the district hospitals. If we were not there at the time of her complications, then the mother as well as the baby won't have survived.
This young woman's story of survival, along with the healing of SUNYI'S burns, are testaments to the benefits of quality healthcare. Health programs such as these are helping Nepalese to build a solid healthcare infrastructure that will benefit remote village communities for years to come. These programs rely on funding from bilateral organizations, corporate sponsors, and individuals. To find out how you can contribute, please contact the Himalayan Outreach Foundation.